Dre. I'm Tiana. I'm going to be your student physical therapist today. I just heard you had surgery on your back yesterday. All right, so do you remember the precautions that your surgeon told you?
No.
Okay, so those precautions are going to be no bending, lifting, or twisting of that back. So just remember your BLTs when we're moving you. Okay, with that being said, we're going to try to get you from this bed to the wheelchair over here. Okay, so first thing I'm going to do is measure you for the walker that we're going to use to get you to your wheelchair. Is that okay?
Yep.
All right, so I'm just going to lower the sheet. All right. Measure down to the sole of your foot. Okay. All right. So now what we're gonna do is a log roll. So I'm gonna roll you onto your side towards me. Okay. So for this technique, I'm gonna have you bend your knees if you can. Does that feel okay?
Yep.
All right, and so during this roll, I just want you to try to be as stiff as you can because we don't want that your back to bend or twist while we're doing this, okay?
Yep.
So on the count of 3, I'm gonna roll you onto your side. Ready? 1, 2. Now we're gonna sit you up. So I want you to push through your left elbow, and at the same time, I'm gonna swing your legs off the chair so we can get you to stay, okay? So on the count of 3, we'll do that. 1, 2, 3. Good. All right. So now, we're gonna go ahead and put your socks on. Get up to the back. You're all covered. Looks pretty good. Okay, so now I'm going to lower this table for you until your feet touch the ground. I'm going to put this gait belt on you. I'm going to put it a little bit higher because of that incision on your back. Is that okay? Okay. Hug.
What we're going to have you do is you're just going to
Does that feel okay?
for a second. You go
Okay.
ahead and scoot forward a little bit and kind of rest that heel on the ground if that's more comfortable for you. So what I'm going to do is show you how to ambulate this device before I get you up. So I'm just going to have an idea.
Okay, I'm just gonna teach you how to get up using the walker. So what I want you to do is we're gonna keep your left hand on the table here and then place your right hand on the handle. We're gonna place your left foot just a little bit farther forward than your right, and then your right foot as far back as it can while still being flat. And then we're gonna go nose over toes to stand up. So we'll do this. Okay. All right, so let's go ahead and try that. Left hand on the bed there, right hand on the handle. Alright, so with that left leg, we're going to put a little bit farther forward than your right, and then we're going to use that right, really put a lot of force through that feet to stand you up, okay? So, and then remember, nose over toes, and I've got you.
Okay, so now
Okay, on 3, we'll stand. Good. And then go ahead and relax your arms by your side. Looks good. Come over to your left side.
All right, any questions for me today?
We're going to take a series of small little steps to turn you, and then those same small steps we're going to do backwards to get into the wheelchair. Okay, so I'm going to support your knee just because you do have some weakness in that left side. All right, so whenever you're ready, okay? Back up just until you feel that wheelchair on the back of your knees. Good. And then with your left arm, you can go ahead and reach back toward the wheelchair armrest. And then we're just going to slowly sit down. Okay? Feel okay? All right. Hi, Dre.
Hello.
Good to see you again. How have you been doing?
Pretty good.
Good. Okay, so today we are progressing you to some more walking patterns. So I'm going to teach you how to use a walker today, and then also how to get up and down a curb. Does that sound okay?
Yeah.
Okay. So the first thing we're going to do is get a gait belt on you, just so you can be nice and stable. So big hug. All right. Still going to go a little bit higher because of that precision. Feel okay? Feel okay? Okay, so first thing I'm gonna show you how to use the walker before we get up and practice it, okay? All right, so you've still got a little bit of weakness in that left leg, so the walker is gonna help kind of offset that with your arms, okay? So what we're gonna do is we're gonna move the walker forward first, and we're gonna take a step with your left, and then your right. So walker, left, right. Does that sound okay? So now that I showed you gait, I'm gonna show you how to get up and down a curb, okay? So same gait pattern to get to the curb, our left foot first, then our right, and then we're gonna lift the walker onto the curb, and then we're gonna go with our right foot, and then our left foot down, okay? Here. We're gonna put our walker down, and now we're gonna go our left foot down and our right foot to follow. Does that sound okay? Okay. Now we're gonna stand up, so I'm gonna have you place your right hand on this handle here, and then your left hand on the armrest of your wheelchair. All right, and then on 3, we're gonna go ahead and stand up. 1, 2, 3. Good. All right, so now let's practice that gait pattern that I showed you. Do you remember?
Yeah.
All right, so we're gonna go walker, and then that left foot. Yep. All right, good. All right, and we'll go all the way to the curb, and then we'll practice getting up the curb as well, okay? So now that we're at the curb, now we're gonna lift our walker, and then we're gonna go right foot, left foot. Good. And then going down, and picking up off the curb. Now we're gonna go left foot. So how did you feel with all of that gait and going up and down the curb?
Pretty good.
Feel like you can do that at home?
Mm-hmm.
Okay, perfect. That's all I have for you today. You look like you're doing really well, and have a good rest of your day, okay?
You too. Thanks, Dr. T.
Bye.